again, Chiropractic family. Welcome back to our Inside Out conversations, and welcome back, Dr. Perrella.
Thank you, Dr. A. Appreciate it.
You just shocked me when you said this is our 5th episode.
Yes.
And it's going well. The feedback that we're getting from all of you is nothing short of phenomenal. People are listening, they're understanding how their body works and what they can do to maximize their healing and recovery. And so today, when we were discussing what to talk about, the topic of today's conversation is what we think about, we bring about.
Absolutely.
And so, you know, there is definitely a doing in chiropractic and in healthcare, meaning like there's something that we need to do to the body for the body to respond, but there's also a being. And we can write a book about patient psychology and the impact that patient psychology has on their outcomes. So in our orientation, I talk about very early on in the doctor-patient relationship, I can see if a patient is open or closed. I can feel it energetically.
Sure.
Like this patient that's like, I don't feel anything yet, and they've been here 2 visits, like they're probably not going to do well because they're closed. They're weak of mind and they're closed of body. Yet there's another patient that's like, I know I'm struggling, but I feel super comfortable with you guys. I'm all on board. Just let me know what we got to do and let's go. And that person is open, they're strong, they're not where they want to be yet, but they're ready to like form a partnership. And so when we say like what we think about, we bring about, like if we're thinking all the time about what's wrong, then we get more of what's wrong. If we think about where we want to go, then the brain, the mind is an amazing attractor beam. Now, it's not enough to just sit around and say, I'm getting well, I'm getting well, I'm getting well, I'm getting well, and not do something. Like we still have to like take action. So we've got to have this combination of the right psychology and headset coupled with the right action. And from a chiropractic perspective, like this is the right action chiropractically. Like we do really strong, sound, precise, powerful work when we work up in the brainstem area. And so sometimes people heal quicker than they expect. Sometimes it's right on the same time frame that they expect. And sometimes it takes longer than they expect, and that's okay too. So when I came to you yesterday, I said, "Hey, what do you want to talk about on Inside Out this week?" And you talked about your recent article. What is it? Stop complaining. Stop complaining, which is it's bold.
The high cost of complaining.
The high cost of complaining.
Yeah.
So why don't you speak to like what made you write that and how that integrates with what I'm saying?
Yeah, no, absolutely. Yeah, you know, this is this concept where it is, where what we're thinking and how we're thinking is also affecting the physical response, this mind-body connection. And what we were talking about with the high cost of complaining was not that we're negating the fact that someone has a problem, but that the brain is creating neuronal connections all the time, right? One brain cell is connecting to the other brain cell, and it forms these patterns. And that if somebody is repeating constantly all day long that I have headaches, I have fibromyalgia, I have indigestion, I have back pain, I have shoulder pain, you're literally cementing that into the brain. And if it's cemented into the brain, it's going to be cemented into the body. And so one of the things we look at...
Well, the ego starts to identify.
It starts to identify. It becomes your identity, right? And I remember early on in my own healing work, this chiropractor saying to me, you know, we need to change conditions from nouns to verbs so that it's not something of, I have a headache, but I'm headaching, right? Or I don't have fibromyalgia, I'm fibromyalgia-ing. And so this idea that there's this concept that all your activity, everything you're doing...
Like I'm vomiting.
Yeah.
Yeah. Okay, I got you.
Yeah, right?
I'm not a vomit, I'm vomiting.
Right,
Okay, gotcha, I understand.
Right, yeah, and we're trying to separate the person from the condition.
Right, I'm not vomit, I'm just expressing the symptom.
I'm expressing the symptom.
Right.
Because the reality of it is, we could call it anything.
Right.
Right? You could call fibromyalgia Zofstic.
Right.
The person's still going to feel the same.
Right.
And so we look to have them connect to say, look, there's a cost here to complaining. There's a cost. This isn't something that you're just doing that doesn't have a consequence to it. The consequence is that it's actually producing further ill health and further ill-being instead of well-being. And so it's this concept that we've all been taught to complain. We really have. And to understand the cost of it is that can become part of your identity. And then once it becomes that, it's very difficult to overcome the condition.
Yeah, and people are hearing this and they're going, okay, so I'm not supposed to like talk about what I'm feeling, and we're not saying that. Like we do care. We want. In fact, we care so much that it's on the top of everybody's chart. What your chief complaint is, what your symptoms are, and to another level, what it's interfering with in your daily life. We write all of that in your chart. We want to know not only do you have migraines, but what are those migraines keeping you from doing that you want to do? And we know all of our patients' core values, like what's important to you. But then we take that information and we just put it over there. And further, and then you want to elaborate on that. No one on the other side of this would walk around telling people they have cancer when they don't have cancer. No one would ever say it. They would be afraid to say it for the fear that just saying they have cancer would give them cancer. But yet they'll go around saying, I have sciatica, I have migraines, I have headaches. And but why is it different in the patient's mind?
Yeah, because there's a disconnect there. And like you're saying, we acknowledge that this is a nervous system that's under distress, right? This is a nervous system that's subluxated, a person that is walking around in a subluxated state. And what we recognize when they come in and say, well, this is my condition, is that everything that has preceded in their life to now has resulted in that condition, right? We have this saying in healing work that we're no longer living in our past, but our past is living in us.
Sure.
And that's the subluxated state. And so a big purpose of why we do what we do in having them disconnect from this complaining or to understand the complaining is to realize that it's disconnecting them from their own experience and their own healing. And how are you going to get better? Because you've separated out that this condition is something that's separated from you, right? That's something, somehow this thing just dropped into your body, as opposed to realizing, all right, I've been through certain experiences in life, and those experiences have been physically damaging, emotionally damaging, chemically damaging, and that is, the result of that is this place that you're in today. And so what are we always looking at is change, to say, well, okay, you're saying that you have migraines, you have migraines, you have migraines. Let's shift that a little bit, because obviously, how many times we have to say we have it before we get better, right? There is no, that doesn't even make sense, right? How many people do you have to complain to that you have this condition before it gets better? And again, this is a nonsensical statement. There wouldn't be any number of people. But if you start to separate out and realize that everything you've experienced in life has resulted in the migraines, that this is a part of your life experience, well, then you can start the process of changing or unwinding that experience. And that's what we're doing with the adjusting. This expression we use, we're clearing out subluxation. We're clearing out this state. It's not a thing that it just happens all at once. It's a state of being. And so by changing this concept of complaining, we're also changing the way the brain is being, and therefore how the person is being. And once that happens, that starts to snowball this cascading effect of healing, where now the person has broken out of this stuck place of I have this, I have this, I have this, and now they've entered into this more proactive healing place. And the beauty of that is that the patient now takes charge. Instead of turning the condition, turning themselves over to the doctor, and that's the majority of the system, where you just go and something is supposed to be done to you that this thing you're experiencing goes away.
Like a passive participant in the process.
It's a passive participant. You heard me say a number of times, it's like going to the fire, pouring water on the alarm. the alarm might turn off and everybody's happy that that symptom of the alarm ringing isn't there, but the building's burning down.
Sure.
And it's the same thing with our bodies.
Let's define subluxated state.
Yeah.
So I'm kind of listening to you from a patient's perspective, and I'm like, okay, what's subluxated state?
Yeah, because it's a great question, because it's a word we don't hear, right? And it's the condition that the person is walking around. What happens is that as a result of all our physical stressors, chemical stressors, emotional stresses, and traumas that we have experienced in life, there's literally tensioning of the spinal cord and brainstem.
Because the body's going into like a defensive posture. I'm protecting. I'm protecting.
And we use these expressions, right? I'm all wound up. I'm all bent out of shape.
I'm so
all
tense.
Twisted up. You know, like
I'm high strung.
I'm high strung, right? And we know this now today that with the advanced imaging techniques that we do see interference in cerebral spinal fluid flow, we see tensioning in the spinal cord,
different brain patterns,
the different
what happens is there's a downregulation of the prefrontal cortex where your executive and cognitive function is, because your emotional centers and your reptilian brain is on fire because it's in like an emotional survival mode.
Absolutely. Absolutely. Right.
So, does the adjust? How does the adjust? So the subluxated state is basically this stress response. Now, not all stress response is bad. Like the stress response is supposed to be like on for a little bit. Like if we got into a dangerous situation, like, oh my God, I either got to fight or I got to run.
Right.
But where the stress response becomes a problem is when it's left unchecked and it's always running all day long, every day for weeks or months. That's
just doing a slow burn.
It's a slow burn,
right? And this is where people come in. I'm exhausted, no matter how much I sleep. I just don't have the energy to get through the day because we're not resetting, right? We're not going into that parasympathetic state where we reset, right? With these different tools, whether it's meditation, breathing, exercise, going out for a walk. And the biggest is the adjustment, absolutely. And so, you know, everybody to some degree is walking around subluxated because they've experienced life on this planet.
Sure.
And so really everyone needs to get adjusted. And we just don't say that. It's a condition. You don't put on your TV and see 8 commercials an hour for subluxation.
No.
You do for a pill.
Right.
And so there's a subliminal there that goes in that says, you don't have any responsibility. Take this red thing, green thing, yellow thing, and you're going to feel better with it. And so the healing does become this shift, first an awareness that, oh, this thing called subluxation or this subluxated state is real. And every time we have a patient that comes in and we see this in this consult, and in the consult, and they tell us everything that's going on, and then we tell them about subluxation, the subluxated state, and they go, oh my God, that makes perfect sense. No one ever talked to me like I was a person.
Right.
They talk to them as their symptoms. And it's just really, like you say, a stress response. Subluxated state is a stress response that's on all the time. We have people now with snow, right? They slip, they fall on the ice. They slip on the ice, they fall on the sidewalk. They come in, they'll say, well, maybe my neck hurts, my back hurts, I slipped and fell. But we bring them to a next level to say, you have to understand that what happened was you weigh maybe 150 pounds, 180 pounds, whatever it is. That's energy coming down. That hits the sidewalk. The sidewalk's not moving. That energy comes right back into your body and it's absorbed by the nervous system. And you were in a certain posture at the time that impact happened. And so, boom, now you're like this. And you're walking around like that to some degree and not even realizing it. And now the headaches start, or the shoulder pain, or the neck pain, or the indigestion, or you can't sleep, or because it's in there. But what do? We get in there with the adjustment, especially with the upper cervicals, and we're releasing that trauma pattern. We're finally releasing that energy that's stuck in the system so that the body goes, oh, and the person can recover. So it's always a subluxated state is a lack of recovery from what we have experienced in life. And the reality of it is it's everything from birth all the way up to the present moment, whatever your age is, 20, 30, 40, 50, 10, 5 years old, whatever it might be. That's all been stored, right? Every experience we have in life is stored in our nervous system, causes an imprint, a memory in the brain. And so these traumatic experiences or injuries are stored in the brain and in the nervous system. This is the subluxated state, and we're releasing that so the person can recover.
So I'm going to, eloquent, I followed you. Hopefully they followed you. So I'm just going to kind of repeat it simply. We have accumulated stressful events in our life. They come in the form of physical stress, chemical stress, or emotional stress. Some of them are a one-time event like a car accident. Many of them we don't even remember. Some of them are prolonged stressors, maybe a bad relationship or a bad habit that accumulates in the nervous system. The nervous system's role is to adapt to the stress. It's doing it for a while, but then it starts to not be able to adapt because the stress overload is accumulated, and that is now putting the central nervous system into a defensive posture. It's getting exhausted, and then finally a symptom shows up. The person is trained to go to the doctor, tell them what the symptom is. The doctor is trained to name it so that they can bill it and it can get treated. And the whole system is about naming, treating. But nobody is going back to the initial ongoing stressor that created this change in this human being's physiology. Everybody's focusing on treating the end result. And that's the process. And the adjustment comes in to basically like take the Etch-a-Sketch that's all dirty and used and reset it. Or if you have like the timepiece going on your Mac and it just won't do anything, and you go Control-Alt-Delete and you restart the system. And that's what the adjustment does. But for some people, the stress has been there for so long that it's accumulated for so long that it takes a bunch of shakes.
My gosh,
And if they come in continuing to focus on the symptom, they're not unlocking from that pattern. And so they're reinforcing it. So we say, well, what we think about, we bring about. And now from the patient's perspective, they may go, well, I want to tell you what I'm feeling, Dr. Perrella, because I don't know if that's going to change like how you adjust me. And if I don't tell you, how do you know what to do today? How would you speak to that?
Yeah, exactly. Yeah.
So I'm the patient. Dr. Perrella, I want to tell you what I'm feeling so that you know how to adjust me.
Right. Yeah, and it's really not a necessary thing because we're looking for subluxate. We're looking, what's the subluxated state that the person is in that day? And so whatever they're experiencing is related to that. So again, if we're going to change the adjustment, I wouldn't even know how to do it, but if we had to change the adjustment to correlate to the symptom, again, we're showing up at the fire and pouring water on the alarms. Now, the purpose of the adjustment comes to eradicate the symptom. The issue with that is that you're putting the person at war with their own body. We're trying to eradicate something. There's nothing to eradicate. There's the healing energy to free, right? There's their healing response to free. And so it's almost, I don't want to say it's a waste of time. So I understand everybody needs somebody that they can feel heard by. And we do, right? We hear people and we connect to people. And we're always moving them to a greater level of healing with what we're saying and what we're doing in that adjusting room. Because if they come in, they say, my neck is killing me today. And you've often heard me say to the patient, well, let's switch it around a little bit. Your neck isn't killing you, you're killing your neck, but your neck is letting you know about it. So now what's going on in your life? What has happened between the last visit and here, physically, emotionally, chemically?
And you know what they say? I slept wrong.
I slept wrong.
Like, how can you hurt yourself sleeping?
Yeah.
It's probably something else.
It's probably something else. And when we ask them, and then they'll say, well, I have this really stressful situation going on, or things are really tough at work, or maybe a spouse or a loved one is not feeling well, or they're in the hospital. And what we're doing with that is, again, bringing the person back to themselves, that they understand that they have this ability. We all have this natural ability to connect with ourselves and understand why we're feeling the way we're feeling. And the adjustment is a big part of that. The adjustment so much clears the interference to the person to feel what they're feeling. And this is why we say in healing work, and it's so different than the fix-it model, that in healing work, it's not necessarily about feeling better, it's about feeling more. And the more you're able to feel, the better you're going to feel, and the less connected you are then to your symptoms or your condition, because the ultimate goal is what? To get past where you're at in life.
I guess it would be similar to like therapy, where like if somebody goes in and they're anxious or depressed, and they go, I want to get rid of this depression or anxious feeling, that's not how you get rid of it. You don't get rid of it, you get rid of it by finding out what's underlying, what's underneath it all that's making that. And you know, I think patients come in thinking like it's almost like a toothache, like, oh, this tooth hurts, so I have to get it removed or filled. But that's not how chiropractic works. It's not something to take out of the body. I would say it's more similar to, let's say you were 30 pounds overweight and you didn't have strength. And you said, okay, I'm going to hire this world-class nutritionist and this world-class exercise physiologist, and I'm going to lose 30 pounds and I'm going to put on lean muscle. You don't go into the gym every day and say, I'm overweight and weak today. I'm overweight and weak today. I'm overweight and weak today. They're going to look at you like, that's why you're here. Right. We need to, and you wouldn't go to the nutritionist and the trainer and say, I'm overweight and weak today, do something to me to make me feel strong. You know you've got to show up and do work. You've got to do the work. So there is a part of chiropractic that is passive, like, oh, here's my body, I'm going to lay on the table, do something to me. But the same way, there may be things that you need to do outside of your chiropractic visits, and it may start here.
Sure, and I think too, even with the adjustment when they're on the table, is opening up to your own healing. You know, let
not being this guy.
Yeah, you know, and realize, okay, I'm coming here to heal. I'm coming here to have that experience, because everybody wants to feel great. And the way to get that is through healing, not through fixing. This concept that, oh, if I just get rid of all my symptoms, I'll feel great. And it's like, well, first of all, it's an impossibility, because you're focusing on the symptom. And it's just good, the body, anytime that stimulus that came into your life to produce that in the beginning comes into your life again, you're going to repeat all the symptoms, because the ability to adapt to that has not been improved, because that's a subluxated state. When we're clearing that and these stressors come in, we're better able to adapt. And again, it's not ignoring the person. Sometimes it gets frustrating that people will get almost insulted that you're not addressing the symptom. And then what I'll do with people is I'll say, why are you getting insulted? What does this mean to you that you think I'm not listening? Where did this happen in your life? You know, was this a parent that you felt ignored by? Was this a mother that was not emotionally connected? Was there something where you felt abandoned in life? So again, it's connecting, it's bringing that person, it's getting them to a sense of awareness of, oh, this stuff is going on inside of me, because all this stuff has happened and I'm subluxated. I'm in this subluxated state. So the best thing to do as you're getting adjusted is to open up to your own life. Just let how it has to happen. You know, sometimes people.
It's like the book, The Surrender Experiment.
Yes.
There's a bit of surrendering.
There's a surrender.
Surrendering that needs to happen.
Because we can't think ourselves
You can't think yourself well. You can't control the experience. Right. We have a patient, obviously not saying names, and he's like, I think if we just adjust longer, or I think if we just push harder, and I think if I come twice a day, and he's very type A, and he's a very controlling person, and just no, like that is your subluxation. That's the piece that when you let that all go and allow someone to care for you, everything will change.
Everything will change. Yeah, and you know,
I know you know what I'm talking about.
No, yeah, and I've had patients that have said, well, how come it took so long? And I'll say, because you were stubborn. You were stubborn. At the beginning, how many times did we tell you? You had to change. You had to allow change to happen. You had to let the program work. And, you know, it really always works. It's just, is the person allowing the working that's happening to happen, or are they allowing their belief system to literally block their healing? And that's again where personal change comes in, right? If the person comes in and their focus is to get rid of this pain, it's like me saying, okay, I want to let go of this book, but I'm holding on to it. I'm constantly realizing that I'm holding on to it.
Yeah.
How am I going to let go? I have to shift, right? I have to let go. And a lot of times we need to let go of that stuck place. All the time, you have to let go of the stuck place we're in, because that's our subluxated state. The adjusting is helping you do that. But if you're laying on the table and going, I'm not going to let this go, I'm not going to let this go, I'm not going to let this go, and then 4 months later say, my problem really never resolved. Yeah, because you never let go. Mm-hmm. We kept telling you, let go, let go, let go. And why do we fear letting go, right? How many times to just let our emotions out or our feelings out or to express, right? Because we grew up in cultures or households or religions that said, you're not supposed to express anger, or you're not supposed to cry, or you're not, right? Women get the big one, don't express anger. The big one for men is you're not supposed to.
No, the women go like this. They say, and this is a generalization, but they say, I can handle a lot of pain.
Yeah.
I hear that all the time. Like I can tolerate a lot of pain. And that's cultural.
Yeah.
That's cultural.
Yeah.
Yeah. We shouldn't have to handle or hold on to our pain. We should be allowed to express it and let it flow through.
Yeah.
So let's do a formula for success. Okay. So I'm a new chiropractic patient. I'm new to this whole journey. I'm not getting the answers elsewhere by treating symptoms. How should I show up to my visits so that I get the most out of my care? What do you want me to do, be, and think, and feel, and act? Like, how should I be?
Yeah, it's not hard. It's a one-step thing.
Okay.
It is simple. Be open and allow the doctor to do the adjustment. Be open, surrender all thought, surrender all ideas about how this is supposed to go, because most of the time you're going to be wrong anyhow.
Correct.
It's a saying we have in healing work, you never get what you want, but you always get what you need. And so to come in to say, okay, I don't really even know what's going on. I don't know why I'm even sick. I don't know why I have these symptoms. I don't know why I have these conditions. And I am with that going to open up to my healing. I'm going to come in here. I'm going to let myself release, relax, open up on the table, let the chiropractor do the adjustment, and let the adjustment move wherever it may, because that innate intelligence knows where to go with that adjustment. So it is learning to surrender. It's learning to change, because we don't even have that teaching about change in life. When I first started healing and this chiropractor said, Gerard, you can change, I didn't even know what that was. Like, I don't even, what are you even saying? I don't even know what that is. I thought what I have is what I have. He's like, no, all this can shift. And so to understand, to break immediately that habit, and the way we do it is just to say, I'm going to be open. I'm going to surrender. The moment I walk into that adjusting room door, I'm going to surrender. I'm going to stop any symptoms that I'm talking about. I'm going to stop with the complaining. I'm going to stop. I'm going to come in, because the time you take even to tell us, you could be on the table healing. We don't want to negate. If it's something really bad, of course, but if it's just a shoulder pain, neck pain, you got a headache,
or more of the same thing that we know about.
Right, we know about.
So this is what, I would want the patient to realize. We do our due diligence in the beginning. Like no one does a 20-30 minute consultation in healthcare the way we do. Right. We go all the way through the health history. We look at any prior imaging. We do a physical exam. We take x-rays. We do our neurological testing. We make sure that the person is the right candidate for chiropractic care. We make sure it's going to be safe. We make sure we feel that we're going to be able to help the person. We have our objective criteria for subluxation. We handle all of that for all of you, everyone. Mm-hmm. Know that that's being done. Then you can trust. You can trust that we've got the sound clinical steps in place to care for you. You're going to be safe. You're going to be okay. When you're on the table, be in a state of gratitude. You may not be where you want to be yet, But there are things that we can all be grateful for here. We're alive. We're here. We showed up today. We've got this beautiful country we live in. We're not outside in the snow. We've got heat on and we're comfortable. And we can be grateful for our family. We can be grateful for the oxygen we're breathing. We can be grateful for the means to be able to come in and get chiropractic care. We can be grateful for the access to the professionals that happen to be in a drive, within a drive. And in that state of trust and knowing and gratitude, when we're on the table, we're not talking about the snowstorm or the Super Bowl or the things, the distractions, the noise. It's like the teacher in Peanuts. It's all around. Go inside. Trust. Know. Be grateful. Receive. You know those people that like to give holiday gifts, but they don't like to get them? Yeah. You gotta be able to receive your adjustment. And if you're closed down, wondering if it's going to work, trying to control it, not trusting, questioning, talking, like it's just going to bounce off you. You might as well not come in that day. Like, show up. Like, imagine going to the gym, you don't have your sneakers, you don't go on the equipment, and when you're on the equipment, you're just talking and not moving, and you expect to get results. You have to show. No one ever teaches you how to receive an adjustment. That's our job. Yeah, we have to teach them how to receive. Exactly. You and I lay on the table. Yes. We're just lumps. Right. Be a lump. No, be a lump. It's the one place you finally get to be a lump. Do it.
And it's good for you. And
it's good for you.
I want to make a real distinction between negating and connecting.
Yes, we're big on connection.
It's connection. We're not saying negate. If you come in and you're just in a, people use the word bad place. I don't believe in a bad or good place. We're just always feeling. We're feeling what we're feeling. And to allow yourself to feel. I'm not somebody that's all about, you got to think positive.
Yeah, no.
You've got to feel fully. We are human beings. If you are sad, feel it fully. Because if you're trying to resist that or you're judging or that becomes bad, now you can't feel that anymore. If you're feeling angry, feel angry. If you're feeling grief, feel the grief. Don't see it as a symptom to negate. If you're feeling joy, feel the joy. And one of the beauties about chiropractic as we practice it is it's so rewarding to see people open up and connect to themselves again because they're allowing it to happen. And they come back and they say, my gosh, I went home after the last adjustment. I cried for 2 hours. And we're overjoyed with them because they're clear. Or I had this thing, I had this abuse when I was a child. And the anger of that finally came up and I finally connected with it. And I see why I've been having headaches because I've held that anger against my mother, my father, my brother, the man next door, the woman down the block, the teacher that abused me, whoever. And we're realizing this person's finally blowing open. They've been this and finally they're like, hey, I can be me. And how many of us didn't get that message as kids that who we were was totally acceptable just the way we were. And that again subluxates. And we're not even aware sometimes of what we even went through and how that has affected us. And so one of the things I really love about the work we do here is we allow everybody to be who they are and we encourage them to do that. Hey, your back hurts? Be fine if that's what's happening that day, but feel it. Connect with what has happened. That back pain did not drop in out of the sky. Your back, you didn't wake up this morning and your back said, you know what? Tom's really been aggravating me lately. I think I'm going to give him some pain. It's like, no, the back, things have happened in your life. Connect. And like you're saying, we can't connect and be talking about it at the same time when we're on the table. Lose the fear of opening up to yourself because we all have it, because probably a handful of us were allowed to fully express ourselves completely and openly growing up. I don't think anybody gets that. People come out, they say, 80% of all families are dysfunctional. I'm like, no, I think all families are dysfunctional in some way.
Yeah, sure.
Right? And so it's understanding that every life is different, every life is unique, every life is wonderful. We've all been through what we've been through. The joy is that we can heal if we just open up to it. And that's what we encourage people to do. And that's why that article, The High Cost, to understand this is your life. You're costing your life by doing that. We want to know what happened, right? When they come in, we always ask them, well, what happened? We get into their lives because we know headaches and neck pain and indigestion and fibromyalgia. It's not what walks into the office.
Right.
It's a person that's experiencing this dysfunction in their life, of their nervous system, this dysregulation of their nervous system. So we want to know what's happened to you physically, chemically, emotionally. We ask them that in the consult, right? So we're open to it, is the point I'm making. If we are open to the patient's experience, you as the patient, be open to your experience and know that we're loving you in that experience and in what we do with the adjustment. And you're going to see the miracle of your own life unfold, and you're going to be blown away beyond your wildest expectations. It's that one thing: open up to yourself, connect with yourself, let it happen, let yourself experience everything that makes you human and heals you, and the adjustment will clear it all through.
My favorite flower is a rose. And it speaks to exactly what you're talking about. When you get a new rose, the bud is just wound tight. It's so tight. It's so tight. And so many of our new patients are wound like that, and some will never open. But when that rose finally opens, and it's just completely open, the petals are like butter. There's just butter, blah. Like, that's where we need to be. Now, we recognize there is a mechanical. Chiropractic's not purely mechanical. It's like what we do. We are experts in biomechanics, and we understand, like, there's a herniated disc, the pelvis is low, the body is turned, the neck is twisted. But you can have two patients with the same mechanical problem and do the same mechanical intervention, and one heals and one doesn't. And that's what we're talking about. What's that something else? And sometimes it is that what you think about, you bring about, and how you show up matters. And are you closed or are you open? So I've committed to being more rose-like everywhere in my life.
Right.
And I hope the patients do too.
Absolutely. Yeah. Great analogy. Yeah.
So thank you, everybody.
Thank you very much, as always, everyone. And good healing for everybody. Love and healing. And believe in yourself.